What are visa trainee physicians in Canada? They're international doctors who come to train in Canadian residency or fellowship programs on temporary visas, usually funded by their home country, with an expectation that they return after training. They're not part of the Canadian Resident Matching Service, which means that they don't compete directly with the Canadian graduates or the Canadians and permanent residents who train internationally for the same residency positions. Basically, they have their own way to get into residency training in Canada.
Critics suggest the country's limited residency spots shouldn't be wasted on people who won't practice here as doctors. Federal data suggests the country will be short some 44,000 physicians by the end of the decade.
So how many are there? According to the latest Casper National IMG database report, Canadian programs accepted 151 new visa trainees into first-year residency positions in 2024, with a total of 768 visa trainees across all residency years, with thousands more across all physician trainee levels, including the fellows.
The Federal Immigration Department approving permits that allow foreign doctors to train in Canada through the visa trainee program.
Yes, without the LMIA process, they are ignoring our application to insist on finding out what the impact on Canadians is.
Studies show most leave Canada after training. Only 11% stay in the Canadian healthcare system after 10 years. So if the retention rate is poor and doesn't contribute to the doctor shortage in Canadian healthcare system, what is the incentive to keep training them?
That's a darn good question. What's happening is that the faculties earn $100,000. That's what they charge each year. So it's a very good source of income. Millions of dollars are earned every year by the faculty. They can use that money at their discretion. And so what they're doing is using, taxpayers' resources and our trained doctors to train these foreigners.
$100,000 per trainee per year. Money that goes directly to the hospitals and universities, not the public system. So officially, the visa trainees don't take away the residency spots from the Canadian doctors, but in reality, residency training capacity is ultimately limited by preceptors, hospital resources, and clinical teaching time. Critiques argue that this uses up space that could otherwise support more Canadian citizens and permanent resident doctors, 88% of whom are retained for the long term and would stay in the Canadian healthcare system to practice. In the middle of Canada's doctor shortage, should residency training capacity be focused first on physicians most likely to stay and serve the Canadian patients, or the ones who train here and leave? What makes more sense to you and why?